Hello, everyone. This is Dr. Sam again. Today, I'm going to talk about another mental health condition known as personality disorder. As usual, please kindly read my disclaimer before we proceed. Before we proceed to discuss about what a personality disorder is, we need to know what a personality is. According to the American Psychological Association, personality refers to the enduring combination of characteristics and behavior that comprise a person's unique adjustment to life. These include a person's major traits, such as interests, drives, values, self concept, abilities, and emotional patterns. Again, is a combination of enduring characteristics and behavior that make up a person's unique adjustment to life. Now that we know what a personality is, we can now define what a personality disorder. A personality disorder uh, is defined as a long-term pattern of thinking, behaviors, and emotion that is um, dysfunctional, extreme, and inflexible. And these dysfunctional, extreme, and inflexible combination of thinking, behaviors, and emotion leads to personal distress and makes it difficult for the patient to function in his or her everyday life. Because of their inflexible nature, people with personality disorders also find it very hard to change their behaviors or adapt to different situations. There are three subgroups of personality disorders. So we have got cluster A, cluster B, and cluster C. Now we start with cluster A first. So cluster A is also known as the odd and eccentric cluster. It is characterized by social withdrawal and social awkwardness. Social withdrawal and social awkwardness. Because the patient struggles with distorted pattern of thinking. So the main issue or struggle here is distorted thinking leading to social withdrawal and social awkwardness. The next cluster is cluster B, also known as the dramatic or erratic cluster. Patients in under this cluster manifest overly dramatic, emotional thinking and or behavior. Their main issue here is impulse control. Therefore, because of their impulse control issue, they manifest dramatic, emotional thinking and or behavior. Finally, we have got cluster C. Cluster C is also known as the anxious or fearful cluster. Patients under this cluster is always anxiety ridden. Their main issue here is serious fears leading to anxious thoughts and behavior. Now we will talk about briefly about the different um, type of personality disorder under each cluster. Under cluster A, which is the odd and eccentric cluster, there are three distinct personality disorder. The first one is known as the paranoid personality disorder. The second one is known as the schizoid, and the third one is known as the schizotypal personality disorder. We will go into more details about some of these personality disorder in subsequent presentation. Under cluster B, the dramatic or erratic cluster, we have got four different personality disorders. They are the antisocial, the borderline, the histrionic, and the narcissistic personality disorder. Finally, under cluster C, the anxious and fearful cluster, we've got three unique personality disorders. The first one is avoidant, second one is dependent, and the third one is obsessive compulsive. So all in all, we have got 10 main personality disorders, 3 under cluster A, 4 under cluster B, and 3 under cluster C. As mentioned earlier on, we will talk more about some of these conditions, not all, only some, in more details in subsequent presentations. Thank you very much for watching my video. If you like my presentation, please kindly subscribe. Again, well wishes, stay alive, stay safe, and stay healthy. Many thanks. Take care. Bye-bye.